Hey guys, welcome to Endo Warriors. I'm your host, Callie Greenberg, and this is where we have unfiltered conversations about endometriosis, women's health, and what it's actually like living with a chronic illness. So grab your glass of wine and let's get into it. Hello, everyone, and welcome to a new episode of Endo Warriors. I'm your host, Callie Greenberg, and today we have a fabulous guest on. I would like to welcome Dr. Margo Harrison onto the show. Dr. Harrison is an OB-GYN, a fierce advocate for body independence, and the founder of WaveBy, a company aiming to revolutionize period care through prevention-first formulas, which are backed by science and actual clinical experience. So before we get down to everything about WaveBy and whatnot, can you tell the listeners a little about your professional background and why you created WaveBy?
Sure. Well, first of all, thank you so much for having me. Obviously your podcast serves a community that's been underserved and sometimes ignored or underappreciated or undervalued in terms of their experience. And so I think it's really great that you're giving voice to yourself and to others who are going through this experience. So grateful to be here. Yes, my name is Margo Harrison. I'm an OB-GYN. I trained in New York City and got really interested in research after residency, really was a labor and delivery and hospital specialist, and then spent about half my time doing research. And that sort of allowed me to dip my toes in the waters of research, what it's like, and got interested enough, I think was sort of the innovative side of me, that we actually relocated to Denver, Colorado, where we live now. I was a faculty member at University of Colorado, the Anschutz Medical Campus, and I had sort of special NIH training there on how to do research. And so I ended up being an NIH-funded academic researcher. And then about 3 years ago, I left and wanted to do like real innovation, started a consulting firm working with venture-backed women's health companies and working at Planned Parenthood, where I work now, and have started my own company, Yes. I think it was sort of a combination of repeatedly having ideas that I think are great and, working with other companies on those ideas and sort of building confidence over time in seeing what other female leaders were doing. I was helping them with clinical, with research, with medical affairs, with business development, with grant submissions, with FDA submissions. And I sort of felt like, okay, now I'm like rounding out my skill set and I feel like I have the opportunity to have a real impact. And so I decided to start my own company in, the period pain space.
Amazing. So you've been in rooms and situations most people never see across fertility, pregnancy, abortion care, and all of that shapes how someone views menstrual health. So what moment in your practice or life made you think period care needs to change? And what was that moment you felt like this is actually really urgent?
Yeah. So, it was an actual moment. Like, it's a good question because for me, it was an actual moment. It was in August of 23. And I would say this happens frequently, but a woman sat up from after her abortion and she looked at me and she was like joking. Well, at least that wasn't as bad as my period. And I'm like, that's really fucked up that you'd rather have surgery 12 times a year than have your menstrual cycle, which is something that's going to happen to you 500 times in your life. And so that for me was the moment when I was like, I'm hearing this. This is not a joke. And I feel like I have the solutions. I don't have the solutions for necessarily endometriosis, but I have the solution that can help 90% of women with sort of basic baseline menstrual pain and dysmenorrhea, and should take the edge off for people with severe pain and very severe pain.
That is crazy. But I also relate to that patient in so many different ways because even I had bunion surgery and it's the worst rehab after, but I would have had that surgery over and over again not to experience the pain that I was going through with my period. And since I've started this platform and had a lot of people reach out to me, one thing I continually hear over and over from the endo community is my doctor told me my scans came back normal. I was told nothing was wrong. Period cramps are normal. And as a patient and somebody who has personally experienced this, it is incredibly discouraging. So, why do you think so many women are still being dismissed when they report severe period pain, especially knowing that endometriosis affects 1 in 10 women and can very much so impact fertility? And in your opinion, it's kind of a two-part question. What needs to change with medicine and education for this pattern to finally shift?
So I think it's a combination of a lot of things. I think one issue is education of the patient. I'm not putting this on the patient. I put this on the system. I think there's just not a baseline level of education about the menstrual cycle that women have. You see like horrific stories online of like girls whose moms just are women and they're telling the stories of their periods when they got their period, and like just like no support from the parents. I think our parents of our generation, this was really a taboo subject, not something that they were comfortable with. It wasn't like they were leaning in with us, telling us what to expect, showing us how to put in a tampon, telling us what level of pain they experienced. These were not conversations that people are having. And so I think most people are come from a place of thinking their level of pain is normal or is meant to be tolerated. And so I think it doesn't always make its way to the OB-GYN office. And I think when it does make its way to the OB-GYN office, I do think that like there's just a million examples of women's pain being I don't know what the right word is, like underappreciated, undervalued, like whatever the word is. I don't know if you've listened to this podcast called The Retrievals about these IVF patients. I mean,
Yeah.
It's really like, you go through such a mind fuck of like, it's me, it's my fault, it's my pain, I did it wrong, and people just ignoring every possible sign that they're in excruciating pain. So I think there's, systemic issue of undereducation and women really understanding their menstrual cycles. I think there's a, systemic sort of institutionalized undertreatment of women's pain at baseline. And then I think with endo, like I sort of say this in general about OB-GYNs, and I think it sort of reflects the fact that there's not a lot of women's health research out there. Like everyone's like, we need research, right? But like women have so many questions, and none of those questions really have great answers. And a lot of them, OB-GYNs were not really trained in their residencies to answer. And so it leaves this gap for like all sorts of people to come in with all sorts of like, I'm an expert in this and I'm an expert in that. And the OB-GYN being asked questions she doesn't know. And she's always supposed to say, I know. Everyone wants you to say, like, this is what's going on with your body.
Yeah.
And it's not really acceptable for an OB-GYN to say, hey, look, like, I've had a lot of women coming in lately, like asking me about their hormones. And like, I don't have a lot of training in this and I'm learning alongside of you. I don't have the answers today, but like, I'm in this menopausal training program, or I'm in this, program, or I'm leading it in this way, and we're going to figure it out together. We're going to make a plan, but I don't have the answers today. Like if an OB-GYN said that, I think the patient would be like, thank you for seeing me. Thank you for hearing me.
Yes.
Like,
that's all it is like just some validation.
Yes. And so I think though it is changing, and I would say, I think it's changing for the following reasons. I think that there's consumer pull. I think there's basically consumer pull, and consumers basically women saying like, this isn't okay anymore. People like you starting a podcast like this, us having a conversation that's a straightforward conversation, people hearing the infiltration, the TikTok, the social media, just the conversation is happening, whether OB-GYNs like it or not, and they can either like get on board or not get on board. And I think they are getting on board. They're taking all sorts of like obesity and GLP-1 classes. Like I'm in all these Facebook groups with OB-GYNs, and I sort of see the questions they're asking each other and the training that they're seeking. And so I think they are seeing where the market is, and they are trying to meet the market where it is. But then, of course, there's a younger generation of physicians who are going to have also grown up in that culture, and I think are going to come in with a different perspective. So that's the issue. Now, the issue with endo, I think, is similar but different. I feel like people love to call women's health diseases the invisible disease, like ovarian cancer. Oh, it's like the silent killer or whatever.
Or silent
and,
endo.
Yeah. And so that's sort of how I feel about endo, is like, how many tools does an OB-GYN have? She has a physical exam. she has a transvaginal ultrasound, and then she has like more imaging. And is any of that very sensitive and specific for endo? No. Okay, so the tools suck. And now let's look at the treatments. That she has birth control pills, and she has like Lupron.
Oh God, that medication, I can't. I was on Lupron for all of my rounds of IVF. I felt it was awful. That drug, for me personally, awful.
And the drugs like it. Like, I don't know all the drugs like it, but the drugs like it. They can have fertility implications. Like, okay, so those are the tools. Like, I don't know, maybe I don't know all the tools because I'm not like a practicing GYN, but like, okay, so maybe there's 5 tools. So there's 3 shitty instruments to diagnose and 5 shitty instruments to treat. And one of the instruments to treat is literally invasive surgery that has risks.
It's also, I want to point out too, because it takes a huge economic toll on individuals, because I remember Lupron, when I had to get it, it was thousands of dollars, and insurance is not paying for this. So I think that's a major issue too with it.
Yeah. And so, I mean, just to give everyone a moment of hope.
Thank you.
Yeah. I mean, I think that's sort of like the world that you came up in, and that sucks for you. And I think you're channeling it into something beautiful and opening the conversation. And so something good will come of this. But what I will say, being in the innovation space, is I do think, and this is pathetic, endo's a big market. 1 in 10 women is a big market. And so there is a lot of innovation like entering the space because of the market. And so, I did see somebody who had some kind of tag that's like radiolucent for ultrasound. So you give the patient the tag and then you do the ultrasound and it flags like all the, I did talk to somebody who has an AI for the laparoscope. So you're in the surgery and the AI is picking out like where the physician might not see the endo and helping them do that. I know that there's blood tests now for endo. So I still feel, and I actually will admit, I don't know where the research is on endo treatment, right? Like, so even if we have more diagnostic, it's validating. Like, it's nice to have a diagnosis because then you can, have a community and hear what's worked for other people. And there are certainly apps now that are trying to help people optimize like all aspects of their life for their endo. I don't know where the treatment half of it is, but it's good to have the knowledge. You also need the treatment. And like, it does just feel like so much of medicine is like archaic. Like we have to literally go cut it out, So hopefully there's some kind of like targeted chemo, like maybe find a tag for endo, and there's targeted medications that can like go after those implants. But yeah, I think that's the issue.
Also, and you can tell me what your opinion is on this, but I get really triggered when people call it a condition and not a disease.
Yeah.
Because a condition, I feel like it's like you can cure it. And endo isn't curable right now. And so it spreads anywhere in the body and can infiltrate any organ in the body. And that to me acts the same as cancer.
Yeah, I agree.
And to go back to the insurance part of it, I don't know if you saw the movie Below the Belt.
No.
It's a great, anybody who's listening and wants a like really authentic representation of what it's like for somebody who doesn't have access to healthcare or their insurance isn't great. And it follows a bunch of these women who need laparoscopic surgery for the excision surgery, but their insurance continues to deny it. And so they are forced then to either somehow come up with the money out of pocket, or they go through a really long appeal process. And I was having this conversation with somebody the other day where I was like, I wish people would stop calling it a condition, because to me, it's a disease, and insurance should be covering excision surgery just like it covers a mastectomy.
Yeah. Oh, yeah. Yeah. No, I mean, I guess I'm not aware of it, that piece of it being all the condition. I think generally, and again, systemically, there's an issue with reimbursement for women's health procedures. So like there's something called a cystoscopy, which is where you put a camera into the bladder, and like the cystoscopy on a woman doesn't get as reimbursed as much as the cystoscopy on a man. So it's like the same procedure and they get different reimbursement rates. So I think that is probably very true and incredibly upsetting, but also reflects a wider issue of undervaluing, devaluing women, and like even the diet. And that goes to the OB-GYNs too, because their reimbursement, their ability to make salaries, is like, let's say it's half of what, like, I don't know, the urologist makes, because the codes are like half. Yeah. So, the OB-GYNs work. I mean, I know everyone like hates their OB-GYN right now, but being an OB-GYN is like a really,
I'm sure it's really tough right now.
A really hard job.
Yeah.
It's a really hard lifestyle. It's a really hard job, and it's really not reimbursed that well.
Yeah. Well, I think the next question that I have is really going to be helpful to a lot of listeners. If they are thinking about going to see a gynecologist due to symptoms that they feel are off, but if someone comes to you in your practice expressing that their pain is severe, what red flags tell you that it might be endo, fibroids, PCOS? And along with that, what are some questions that patients should be asking their doctor so that they know endometriosis or something else like PCOS is actually being considered?
Sure. So just to be clear, I'm an abortion provider, and so I don't see patients for continuity of care. And so I don't want to represent that I'm providing sort of endo or PCOS care like over time. But what I would say generally is that when you present to a physician with vague data, they can dismiss you. But when you present with clear data, it's harder for them to dismiss you. So what I mean by that is, my period is 10 days long. It's happening twice a month. I'm using only super tampons.
Or Ultra Plus, like me, 2 at a time.
Okay. So like you need to change it from, like, your question was like, what questions they asked? No, there's no questions to ask. You are telling data.
Yeah.
And so like something that would raise a red flag for fibroids is more like, I have really, really heavy periods, and, they can do the exam. And if the uterus is enlarged, like, the fibroids shouldn't be that hard, and fibroids show up on the transvaginal ultrasound. So fibroids is really like a pretty basic first line part of the evaluation if somebody's complaining of menstrual issues and things like that. And like the fibroids should show up. Again, like in women's health, a lot of things don't have like perfect definitions. Like the definition of PCOS like kind of sucks. Mm-hmm. But I don't think PCOS is a very difficult diagnosis. I mean, it's really like you're seeing all these like hormonal abnormalities. Your cycle is irregular. On the ultrasound, the ovaries look a certain way. And so, PCOS is basically like 1 in 4 women. And it's really just basically diet and weight has gotten a little bit out of control. And when you have extra weight, when you're obese or extra adiposity, that's hormonally active. Fat is hormonally active. And so it messes with the communication between the brain and the ovaries because it's producing estrogen. Mm-hmm. So, it's really hard. You can't just tell someone eat better and lose weight. Like, we all live in this society where like nothing about society is making us eat better and lose weight. But like, there are things you can do to try to help balance the hormones. And if those initial interventions, like inositol is one product, if inositol is not working for you, there are GLP-1s that are evidence-based for PCOS. So I think with PCOS, it's really trying to get your body back to hormonal alignment. And when I say hormonal alignment, I just mean appropriate communication between the brain and the ovaries, because the brain and the ovaries are trying to talk and we want them to talk. And that means healthy ovaries and as little interruption of that communication as possible. And then with endo, so when I like answer the question, like what's normal, like how does a woman know what's normal and what's not normal? I would say it's not normal if it's affecting your quality of life. And like, that's just kind of the answer. And so, I think what's helpful sometimes is if there's sort of a change, maybe, it's always really helpful. Like, let's say, like, this is sort of more of an ovarian cancer thing, but like, let's say like I used to poop every day and now I don't poop every day. But that is something that's like, might be a red flag, right? Or like, but that could be endo too, because as you said, endo is quite aggressive. So like, I feel like a lot of rectal pain and pressure and discomfort in a way that I didn't, used to feel it. And so it's a new thing for me. Like, as more specific you can be about like your bleeding, changes in your pain, locations of your pain, like the more data you give a doctor, the hopefully you're going to trigger something. And you can say, you know, I thought my pain was normal, and then I went to college, and I'm always in the bed at my period, and my roommates are never in the bed. And that feels like it's affecting me because I'm not going to class and they are. And that doesn't feel normal. So, like, what are my choices? And I think the other thing is people really hate going to the OB-GYN and being put on birth control pills. They're like a super anti like hormones right now. So you kind of have to like, what is your goal coming out of the doctor's office? Do you want to consider the tools that she's offering you or not? You know, because those are kind of what you're going to get in that setting. But you can also say like, I'm here because I feel like my pain is not normal. And I would like to like be on a trajectory where we try treatment. And if you're telling me this is my only option, that's fine. If I don't see improvement, like I really would like to know what's next and like what are our next steps. So like yesterday I saw a patient, she had an Nexplanon in her arm. She's been bleeding every day with an Nexplanon. And she was like, well, I have had the Nexplanon before and I bled for 9 months. And I don't want to bleed for 9 months. I want to stop. And so I'm sort of like, okay, well, these are the options that we can do. You haven't made it to the 3 months, which, you know, is like the time. And she's like, I was like, why don't you just get an IUD? Like, why are you doing this thing that doesn't work for you? Just come back and we'll do that. She's like, will you take it out? It's your body. It's your choice. It's not, of course I'll take it out. So I think going to Planned Parenthood is also a place where like you need to make sure that the values of the place that you're getting care align with your values. And Planned Parenthood takes insurance and they care about people's choices and pain. And so I would just very much consider also who you're putting your care in the charge of and how much you think they're going to take you seriously. And I personally would consider Planned Parenthood for your contraceptive needs, your pain needs. They don't do surgery, but like they're going to say like, I hear you. Let's try this thing that I can do. And like, if you can't do this, the next step would be like evaluation for surgery and diagnostic surgery, like, you know, or go to a pain specialist.
Yeah. I mean, you hit on a lot of stuff that I really relate to because like one of my biggest frustrations growing up, because I had period pain starting when I was 13 and it was not normal. I mean, I knew it. I just didn't have language for it. But when I would go into the doctor, not just one doctor, but multiple doctors, all I really wanted was, yes, I wanted an answer to why I was in this much pain, but I wanted kind of like we were just saying, I wanted to be heard and validated and know that the person that I am going to see who is in this role as a doctor is wanting to help me figure it out. And maybe they don't know what's going on, but like they're willing to figure it out. And like you said, refer me to a specialist. And I never had that. I never felt like it was as easy as you said to just like, I'm giving you data. Like this isn't a what if or maybe, like I'm literally telling you what is going on with my body. And and this is what I'm, you know, seeing and hearing from the community is just the amount of women that are being told that it's normal and their doctors aren't doing anything more to help them figure it out. And it's really discouraging. But I think everything that you just said is really great information, especially because no two patients are the same. So what one person's course of action would be to help them is not somebody else's. And I always tell people who come to me for advice, don't be afraid to get a second or third opinion. I think you actually should. I think it's something that I tell people when, you know, I'm in spine for med device sales. And if they're asking me on who to go see for a surgeon, I'm always like, just make sure you get at least 2 different opinions. So I want to get into now because I like really love this product, but what did you personally feel was missing from the existing period pain and cycle regulation landscape?
Yeah, so in terms of pain, we do have guidelines that advise that people like take NSAIDs basically premenstrually. And I just don't know why that hasn't become like mainstream. And so my goal is to get women the right product at the right time and the right delivery mechanism to help them. And so we did launch with some products in market earlier in March, and they were really like tester products, but they're not like the easiest for patients to take. And the price point is not the easiest for everyone to access. And the claims and the things that we want to say about them, we can't say they're not in line with the FDA label. So we are currently fundraising to go through FDA for a new product that will be sort of like a Z pack, like a blister pack that will be like per cycle that you take to sort of help you with your pain and bleeding, and will be approved to be taken premenstrually, and will help women understand what that means and how to do that. But we kind of needed to show that, like, there's a lot of investor language things that I needed to show to be able to get to this point. And I think bringing products to market was part of that. And I do think that the ingredients and the products are out there. They've just not been made consumer friendly and mass market accessible. And so I felt like when that woman sat up, I'm like, oh, treating your period is easy. You just do this. And I'm like, why don't people know that? Why do and I'm not sure all OB-GYNs know that.
No, I don't think so either. And I think there's proof out there that they don't.
So that's just fortunately, it's a great investor story. There's a lot of people in pain. It's a huge market.
It's huge, especially in women, because we are more prone to chronic pain than men.
Yeah. And there's a huge market. There's not a lot of options. We're going to bring the right option to women. And so we're just beginning that process. We're developing a novel pharmaceutical that's direct to OTC to compete with Midol, but is really first-line treatment. Midol's Tylenol, which is really second-line treatment. So I felt like just first-line treatment was missing for women, right product, right time, right packaging. And then part of the success of that product depends on women leaning in on their cycle. And I think irrespective of anything else, it's really important for women to lean in on their cycle, because that is how you achieve bodily autonomy. So let's just say they take away abortion, they take away birth control pills, they take away all the things. If you know when you're ovulating, you can avoid having intercourse.
Mm-hmm.
And that is your choice. And that should help you from preventing a pregnancy if you do not want to get pregnant. Or if you do want to get pregnant, you know when you're ovulating, you know what it means to ovulate. And so just the basics of the menstrual cycle, which is a hard thing to understand. It's scary. It's very inaccessible. And I think it's becoming more accessible because TikTok videos and cycles, and it's trendy, and cycle syncing and seed whatever and all this stuff. I think all of that is good. I don't know how much of it is evidence-based, but I don't care. I want people to understand what their menstrual cycle is, what that experience is like for them. Because then again, back to our point before, when it comes time in your life, when it comes time in your life where you're not ready to get pregnant, you know what it means to try to avoid it. When it comes in time in your life when you want to get pregnant, you can go right and start doing that. And then when it comes to the time in your life where maybe you've had kids and the period changes, that's when a lot of people are like, I never had issues with my period, and then I had kids, and now my period is horrific. Or my period was horrific, and now I had kids, and what is a period? I don't even know. So, that allows you to be I know exactly how my period used to be, and now I know exactly how my period is now, and those two things are different, and I would like you to help me manage that. So anyways, the cycle regulation product that we do have is all evidence-based. All the ingredients have a reason for being in there. One of the ingredients that is in there is the myo-inositol and the D-chiroinositol, which are, in the Canadian OB-GYN guidelines, first-line treatment for PCOS. So better than metformin for PCOS. So this is, a supplement that is evidence-based. It needs to be in the right ratio. Ours is in the right ratio. But leaning in on your cycle, trying to get the cycle more regular, allows you to then lean in on your pain control and take the appropriate products at the right time in order to reduce pain and bleeding.
Yeah, I love that you guys created something different than a one-size-fits-all. And so can you walk listeners through your main products, what they're called, and how do they choose between them?
Sure. So we do have, this is the regulator product. It's called By Irregularity, you're trying to establish regularity. It has the myo-inositol and the D-chiroinositol. So this is a supplement. Everything in it is a supplement. Iron is in it, and that could be considered a drug. But anyway, this product can be taken by any human being, and that includes men. Okay. Inositol can be taken by men. Inositol is basically an insulin regulator. And again, it helps the brain and the ovary communicate. And so remember when I was talking about that axis before, you don't want to interrupt communication. Turns out prediabetes, diabetes, high levels of insulin cause metabolic syndrome. We all know that's the beginnings of PCOS too. So balancing, regulating your insulin is just going to be good for anyone. So this product is really for anyone. But if you're somebody who suffers from PCOS, that product is in there. I would also say that product is helpful for perimenopause. What happens over the course of your life is that you ovulate eggs out of your ovaries. And every time you ovulate eggs, it comes from a cohort of eggs that were recruited in survival of the fittest. The fittest one was ovulated, but the rest sort of atreese, which is a word for die. Mm-hmm. And over the course of your life, you're taking the eggs out of your ovaries. They don't rejuvenate. They're done. And so what perimenopause is, it's the time when the amount of eggs in your ovaries can no longer communicate as well with the brain as they used to. And so you start to see changes in the cycle. And menopause is when the eggs are done.
And it's hell.
And that's just it. That's the way it goes. And I think understanding that concept is really helpful. So anyways, if you have very few eggs left in the ovaries because you're perimenopausal or menopausal, you want them to scream as loud as possible, and the inositol helps them do that. So it sort of optimizes communication between the ovaries and the brain. So the inositol is in there for cycle regulation for anyone, but for PCOS, perimenopause, and I would argue menopause. It has chasteberry in it, which is evidence-based for anxiety and depression. It has magnesium oxide, which is evidence-based for menstrual migraine prevention. I know people like magnesium glycinate. I chose oxide because that's what the papers say. We have iron. We have the bisglycinate in there, which is softer on the bowel, and the vitamin C is to help with the iron absorption. Iron is becoming the new hot topic for perimenopause and menopause, so that's in there. And then folate is in there as well, just because it helps with cycle regulation. People with MTHFR want a very specific type of folate. It's very expensive, so that is not what's in this product, but it is there to help cycle regulate, and then for people who just want to make sure their folate stores are appropriate in case they're trying to conceive. So I call this the backbone product. You take it every night. It helps you sleep because of the magnesium oxide, but it's sachets of pills, and you put it by your toothbrush or whatever. You take it every night, and it helps you sort of lean in on tracking your cycle and thinking about your cycle when your period is not actively happening, but will help prevent all of the symptoms that you have with menstruation that aren't pain and bleeding. So it'll help with those headaches. It'll help with PMS. It'll help with premenstrual dysphoric disorder. It'll help with anxiety and depression and mood stabilization around the period. So that's what that product is for. And again, I said that I sort of made it so that people would lean in on their cycle, pay attention to it, and then be able to take our other products as needed premenstrually. So premenstrually means starting before period onset. It does not have to be precise. If you're 3 days before, if you're 1 day before, it's going to be okay. And if your period comes 3 days early and you weren't able to do it premenstrually, it's still going to work. It just works better beforehand because your body's sending out a bunch of messengers that are saying, it's time for your period, it's time for your period, it's time for your period. And that's when you feel horrific. And then the period happens. And so during that time, we're trying to just reduce the amount of messengers that are getting down there so that everything is just better. You don't feel so horrible. You don't have so much pain. You don't have so much bleeding. So this product is a medication. It's an NSAID. It's a long-acting NSAID. And it is pretty good for basically any person who can take NSAIDs. It's for basically moderate pain is what I would say. This product is a supplement. Again, it's evidence-based. We're allowed to say about the supplements that you can take it premenstrually and it may help with pain and bleeding. So this product blocks another one of those messengers. It also has ingredients in it for PMS and bloating and things like that. So we've seen people have less GI distress on this product. So this is a supplement though, right? It's not going to be as strong as a literal pharmaceutical medication that someone put out there. So this blocks one messenger, this blocks the other messenger. What I would say is if you're severe, go for the dual action.
Yeah, I was going to ask if you can combine.
If you've got an IUD and if you've got a Mirena and you're still cycling through it and you're my period's totally fine, but I do feel depressed and then this would be the product for you. If you're just baseline, I have bad period pain and I want to have bad period pain, this would be the product for you. And then if you're somebody who is missing out on life and is severe, this would be the product for you. But again, these are over the counter levels, right? So you would need to bump these things up if you're somebody with endo who has really severe pain.
Okay. And realistically, what's the timeline for users to start noticing changes when they take it?
Right away. It'll work your first cycle. And then the cool thing is one of the
Amazing.
ingredients in this product actually deposits in the fat. And so with this one, the period should sort of get better over time based on the research.
That is incredible. So one thing I like really appreciate about your approach is how careful you guys are with your claim, and it's, you know, led by science instead of just like buzz. So is there anyone who shouldn't be taking any of these products due to like other medications that they're taking, or pregnant, or have other medical conditions?
I think that there's not a ton of, everybody doesn't do research on pregnant women and postpartum breastfeeding women. And so like, I think Chaseberry doesn't have a lot of data for like breastfeeding and stuff like that. So as you know, we always have to say the disclaimer, talk to your doctor about like what your particular situation is, what medications you're on. There's, I guess, some evidence that NSAIDs can interact with SSRIs. I think all of us have been taking NSAIDs like our whole life. And then we got on SSRIs, all of us, and didn't know that. And so like, that's one contraindication. If you have like inflammatory bowel disease and you're not somebody who's supposed to be taking NSAIDs, you need to be really careful about taking our medications. I would say you either know these things already, or you need to talk to your doctor about your specific situation and show them the box and say, like, this is something I want to take.
Yeah.
I looked up the ingredients in it. I'm concerned about this. I'm not concerned about that. What do you think? And know that like they may not know.
Yeah, that too. And I love who you are and why you created this product, because it's more than just about cycles. It's really, you are empowering women to tune into their bodies and understand what is going on in their bodies instead of just managing symptoms. And for me, in many ways, I'm a little envious of where Gen Z is right now. And I mean that in like the most genuine way, because
you're grieving.
Yeah. And like when I was growing up, menstrual health and talking about like our bodies and what they do was not talked about at all. And the only place to get that information was from a doctor. And so we didn't have the accessibility to resources that exist today. And so it's been really interesting to grow up and see how Gen Z are becoming so free to talk about this kind of stuff. And I think it's amazing. And I think that's ultimately is what's going to help shift women's healthcare, because it's like, hi, you can't ignore us. I mean, you touched on all of the things of the product and everything, but in your opinion, why do you think that menstrual suffering was normalized in the first place?
I mean,
was it just because women weren't researched?
Well, it's just cultural and like myths and things like that. Like even when I'm pitching sometimes to investors, and this includes female investors, they're like, aren't you supposed to bleed? Like, why would we want to reduce bleeding?
Yeah.
So like, I think there's just misconceptions. There's a lot of cultures where like you get your period and like there's some special celebration, right? Like there is some history to this. And I think probably modern diets are making things worse and making the pain worse. And so maybe it wasn't so excruciating the way that it is now. I don't know. But I think traditionally, the medical system was obviously like a lot of men and people who didn't have that experience and couldn't relate to that experience. And that's obviously changed, like whatever. Not that many, I mean, like probably a doctor in the 1960s who was female was like a rare thing, right? So I think there's a lot of trends heading in the right direction. And I think a lot of it just sort of comes from like where we are and where we were.
If you could go back to your younger self, what are 2 to 3 things you wish you knew about your cycle earlier?
So like, forgive me for saying a triggering thing, but like my cycle wasn't so bad. I would just be really, 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 really tired the day before, which was like fatigue is just like, you can write it off. So I'd always write it off. And I'd always get my period the next day and be like, yet again, it was my period. And like, I probably should be tracking my cycle. And I just didn't care, I think. And that's a luxury. I acknowledge that in this setting. And so I apologize. But like, I think it is important to sort of lean in on on being interested in sexual and reproductive health and sort of understanding going into the college setting, things I would have told myself about my period. I don't know. I would just been like more interested in like, hey, there's such a thing as date rape, and like you're going to college and you're going to drink a lot, and like you probably don't know all that much about your sexual and reproductive health, and maybe are not being so proactive about it. But like, this is something that is incredibly important, can change your life in every single different way. And like, you kind of need to know what's going on before you go into sexual activity and situations like that. So I don't know if that answers your question.
No, it does. It's just really interesting to hear everybody's perspective on like the 2 to 3 things that they wish they would have known if they could go back in time about their periods. And I know so many listeners are going to feel very seen when they hear this episode, and because it's conversations like this that are needed and remind us that you're not alone. Experiences bring community, and then once community comes, action comes. And so people like you, people like me, we are the change that's going to happen in women's health. And I love this next final question before we wrap it up. If you could wave a wand and change one thing about period care in the next 5 years, what would it be?
That somebody gives me $3 million to put my product through the FDA, and that every single person buys and uses my product appropriately.
The honesty. Yeah. I love it.
No, I mean, the product is the right thing for 90%, like 80% of people. And it is the right thing, and it is what they need, and it is convenient, and it explains how to take it, and it helps them be in charge of their period. And if they understand how to take it, they understand what their period is, and that ladders up to all the things. So like, if I could change one thing, it would be to have my product available right now for everyone.
I do too. I wish here's what I wish. I wish you would have started this when I was 13, and I would have been able to access it when I was that age.
Yeah. I mean, that's the goal, right? The goal is, and to make it, I want to put it in a case, and I want girls to be like, what's that cute case? And it's like, oh, I got my period. Did you get your period? My mom bought this for me. This is how you take it. And it sort of makes it a trend and cool to get your period and cool to talk about it. And
I love that.
Share that.
I love that. So we're going to make it happen for you.
It's happening.
All the listeners.
Give me $10.
There you go. We're going to make you a millionaire.
Okay. I love that.
All right. Well, I just want to say thank you so much, Dr. Harrison. Like, this was such an educational, informative episode for people and me, myself. And I'm rooting for this FDA clearance because I could really use your product going through menopause right now. But can you tell listeners where they can find more information about you and about WaveBy?
Yeah, so the company is called WaveBy. The idea is like WaveBy to period pain. So it's WAVE.
I love the name.
BYE, and then it's just .co. So waveby.co, we have blogs. I have all my podcasts up there. So there's ones that dive a little bit more into my history. If you want to know about me, you can find me on LinkedIn, and you can learn about our products there. It's sort of focused on this product right now, because we've found that people have a difficult time understanding these products and how to take them. So if you go to this one and then you go to like shop this one, it'll say like, make your whole period kit or like whatever it is. And then you can see the other products in there, but I'm not really pushing the other products too much because they're not super consumer friendly, and we're not totally allowed to say how to take them. And so that's why we're making our new product through FDA. So we'll have all our approvals and claims and everything, kind of like all our ducks in a row to be able to tell people how to take it the right way.
Amazing. And if anybody out there has questions about it and want a more direct answer, please email me and I can get in touch with Dr. Harrison to answer your questions.
We're on socials and stuff like that. We have interns who are there, and so I'm sure they'll forward the question to me if something comes in. But yeah, follow us on TikTok and Instagram.
Do it, guys.
And we're on LinkedIn. We've started posting a little bit there too. So yeah,
great.
We appreciate your support.
Thank you so much. I really appreciate it. And that's going to be it for today's episode, guys. And don't forget to tune in next time. Bye.
Bye.
All right, guys, that is it for today's episode of Endo Warriors. Thank you so much for listening. And please don't forget to hit follow, leave a review so more Endo babes can find us. And tune in next time for a brand new episode. Bye.